Hi guys, Berry Babe checking in. It's been over a week since I checked in, and I had reported then about the wedding being over. The marriage is still intact. It's lasted almost 2 weeks. I'm just teasing. There aren't any problems. I've hardly seen her, but there aren't any problems. I had my appointment with the plastic surgeon for my back lift on Saturday, and I had my weight down low enough. He didn't say a word. I left my shoes on, so I was a pound up from before when I was there. And we talked about what he was going to do, and what he was going to do to, he's going to do some, well, what he's doing. This left breast has a different shape than the right breast, even though the right breast is very small. So he's going to be taking to do the back lift and a little bit of tweaking on the breasts. He's going to take a wedge out along the sides, like under my breast a little bit, and then around the sides, and then bring up about this much skin under my bra line. So I came home and I had black marks. And then for the first time, I had my husband take a picture, and I just kind of grabbed the skin and pulled it up because, you know, I've had several plastic surgeries, and I really consider them restorations and not cosmetic. This is not, I can't say it's not for vanity, because vanity is involved, but it's also, it's restoring, taking me back to what I would have been, should have been, had I not been fat all my life. So then I talked to him a little bit about implants. Because I have tit and titlet, I'm real nervous about coming out even. I said, but I'm just nervous about having you make them the same. I've been looking at boobs. The instruction from the office manager was start looking at tits. I've never looked at so many tits in my life. I found a website where women who are having breast augmentation and breast lifts get on in Facebook and talk to each other, and they put up pictures of their before and afters with little stars and smiley faces on their nipples. And so I'm in there, and he gets out his iPad, and on the wall there's pictures of a girl, I'm assuming. Looks like a girl, but no, it looks like a boy, flat like a boy. And then he shows me tits, and he says, how about those? And he shows them to me from the side. It's like, I don't know. I said, she's smaller than I am, because, you know, she's little. And then he flashes on another one, and I said, can you put some clothes on it? Because I can't look at naked boobs from the side. I don't want a lot of side boob. Some of the women on this site that I'm on, they want obviously fake boobs. They want big rounds up here, and they want a lot of side spillage. And right now my friend calls me willowy. That's because I'm straight up and down. My rib cage and my hips and my waist are all the same. And what I want is enough chest to, when I put on a sports bra, to still be able to have it stick out farther than my midriff in a t-shirt. You all know that when you're on a diet and you're losing weight, you start to feel thinner when your boobs stick out farther than your stomach does. And so that's my goal. And I'm talking fill out a B, and he's talking fill out a C. But we both agreed that, like, Victoria's Secret inflates their sizes. So cup size really doesn't mean anything. He's talking cc's, and that doesn't mean anything to me. So I've got to get through the back lift first. And I've been for my pre-op. And I have to tell you, here's to my weight loss surgery people. The place that I go is a Barracks, B-A-R-I-X, clinic hospital, as well as, it's a private hospital, but the Barracks program is there, and my physician is part owner in the private company that owns the building. And so at the same time I was there for my plastic surgery pre-op, there were people there getting ready for gastric bypass. And it was it was quite an experience to sit there as a thin person and seeing, like, putting myself back. Now, I did not have my gastric bypass here. My husband had his at this location. And, you know, gastric bypass compared to the duodenal switch, it's a harder go. And if they're getting the band, I didn't talk to anybody specifically about it. But I'm glad I'm glad I'm beyond. But that was very unusual for me because I've always been the big one sitting there waiting. And this time, that wasn't the case. You know, I was talking about my boobs sticking out farther than my midriff. Can you hear my dogs? I think they're out back, sorry. I have been, when I went to put my dress on for the wedding, it was tight. And in October last year, when I had tried it on, it had been loose. And I was the same weight, but I had been fasting and I had been walking. So I started walking every night again to try to get some of those muscles engaged, to get that middle part trimmed. Because as a menopausal woman, that's where it all is. That's what's left. And every time I put on an ounce, it goes there, here, and around the middle. And I don't know how much of that's going to change once some of this skin is gone. But it's been a little on again, off again here with the weather, so I grabbed a light duster sweater that I have. It doesn't button, it just hangs in the front. And I found myself wrapping the duster around me. And I think I was out walking in this is one of my little HCG boutique things. It had some a white bottom on it, and I just cut it off. I just took the stitches out and took it off because I like it shorter. But I'm wrapping around me because I don't like my stomach sticking out. Well, I walked like that for a while, and I don't do this. My feet can't take that, and I'm still doing the HCG, so I didn't want to be too vigorous because that'll stall you out. So it's just, I go out and it's about an hour and a half of just walking, and I don't push, I don't slam it, I don't, you know, and it's hilly enough to give me workout. Gentle. So it occurs to me that earlier in the day I had seen my silhouette in this shirt, and I had been pleased by it. You know, my boobs were out farther than my middle, and you know, my stomach area looked fairly trim. And I thought, you liked the way you looked in this shirt. Why are you covering up your middle? Because that's what I always did. If I had had something on and it had fallen on either side of my boobs down my side, my boobs would stick out, but so would that middle. So it was like, okay. So then I just let the sweater hang open. And it's those motor memories, those fat girl memories, those body remembers, things you need to do. You know, like when you go into a restaurant and you're scoping out, will I fit in that booth? Will that chair hold me? I went today to see my dentist who had had an accident, and so hasn't been actively doing work on your mouth. He's got somebody else in there. Fortunately, I haven't had to have any work done since he stopped actively practicing, but he has started doing apnea, sleep apnea mouth appliances, which I guess there's a big need for, but there are very few dentists in the state of Michigan that are, and even in the country, that are trained to do this. And he's just so excited because he's about my age, but he's not ready to retire. And so he's found a new passion, and he spent an hour and 45 minutes with me, just giving me the history and showing me the different models. And then he told me the 2 models that Medicare will pay for. And I turned 64 at the end of the month, and by next July, I will be on Medicare. So if I need adjustments and things, I have to have the Medicare one. This going on Medicare, I do not like it. We have really good health insurance through my husband's work from retirement and Medicare is going to suck. They're so nasty to old people. I don't want to get started on that. So that's the limitation. So I had a problem when I had a bite splint before of having it at the back of my mouth, a gag reflex. So I don't know if I'm going to be able to do this, but I have a CPAP. He said I have a big tongue. Well, you know, somebody told me I had a small mouth when they had the substitute hygienist, but I've always had a big mouth. But I have a big tongue, and my uvula, which is that little thing that hangs down in the back that in the cartoons they're always boxing with. He said it's one of the longest he's ever seen, and it goes down behind my tongue. So if my tongue falls back and then my uvula comes down, that closes off my airways. And in looking at the sleep study that I had last, my air, you know, when they put the thing on oxygen, pulse ox, the thing they put on your finger in the hospital to test your oxygen level in your blood, was down to 80, and 100 is kind of where it should be. And I told him that one of the problems with a CPAP, which is a mask you put over your nose and/or nose and mouth to keep your airway open while you sleep, one of the problems was that I have to get up to go to the bathroom all the time. And because I'm an old lady, I have to pee a lot. He said it may not be that I have to pee as much that wakes me up. It's that my oxygen level drops so low that wakes me up. My heart will start pounding to try and get some blood, because when the oxygen goes low, the heart doesn't get enough blood, so it pumps harder. And that makes sense in that I've been having a diagnosis of resting tachycardia. And sometimes I'll get up and I'll go to the bathroom and I'll come back and I'll lie down and my heart will be pounding and I'll think, what have I done? I must have moved too fast or something, gotten up too fast for my heart to be pounding. It's very possible that at that point my oxygen was so low that my heart started pounding to get me awake, and I didn't realize it until I was back from the bathroom. Because the rule is, if you think you have to go to the bathroom and there's a bathroom available, use it, because you never know. And I think if it takes me half an hour to fall asleep and another half hour I have to get up, it's going to wake me up to go to the bathroom. Might as well go now. It's kind of the way I think. So that may be, I also know that, you know, when I don't breathe enough, I end up with the dizziness, which may be the tachycardia. So it's all kind of going around in a circle, and I was like doing an aha, because if my oxygen drops and my heart starts beating faster, but I'm resting, that's resting tachycardia. And the doctor wanted to put me on like medication, when maybe all I need is a better sleep appliance. I have a new CPAP that I got about 1.5 years ago, but I have not been able to get any relief from it. I don't feel like, I had a heck of a time getting a mask to fit to work. Now I've got one to fit and work, and it's just itching. I don't know if I'm developing a latex allergy or what. So, but I have not had relief from it. So he's going to check with the insurance company, and hopefully Wednesday or Thursday next week I'll go in for where they put that crap in your mouth and you have to bite down, and this has got to go to the very back of your teeth. And he said, you know, gag-wise, it's nasty. And I've had just crown impressions before, and that's pretty nasty. It's peppermint flavored stuff. Oh Lord. But if it helps me, I will give it a try. So today I had lunch with the girls. 3 were there, and tomorrow, even though it's not technically my birthday, we're going to go to Lansing and have my birthday dinner. So then that gives me a week to recover before my surgery for my back lift, which is August 4th. So I'm running out of time. I will check in. Bye-bye.